So welcome everybody. We're on the hour for the webinar on the COVID-19 initiative of RDA, and we're still waiting for a couple of people to come in. Still see the numbers going up, so I suggest we wait for 1 or 2 minutes and then we start. Well, the numbers seem to stabilize a little bit. I even saw it going down, so maybe it's not very strategic to wait any longer. So let's start by saying welcome everyone to this third webinar in this series. A series to keep you, and it would be nice if everyone could turn off the videos, because the moment you put on a video, I lose my screen and the presenting mode. So there we go again. Hopefully you can see it now. So yeah, these series are meant to keep you updated on the developments with the RDA initiative on COVID-19. My name is Ingrid Dillo. I come from Dans in the Netherlands, and I am one of the co-chairs of the working group, and we take the presentation of the webinars in turn, and this day is my turn. So happy to lead you through this hour in which you will get updated on the current developments. I would like to start on behalf, I think, of all the co-chairs with a very big thank you to all of you who have been contributing valuable time and effort to get this initiative on the road in such a short time span. And I must say that we're very impressed with the work that has been done so far, especially since this is all on a voluntary basis next to our day jobs, and also in a time and under circumstances that are challenging for all of us. So I think that for me, this shows again the unique value and the vibrance of the RDA community. So what are we going to do today? Here you see a brief overview of the different topics of this webinar. We will start again with a brief overview of the initiative itself. Then I will hand over to the different moderators of the 5 subgroups to give you an update per subgroup. And once we have done that, we will return to the an update of the processes that we're dealing with at the moment and the outputs that we are working on at the moment. And finally, there will be enough time, I guess, for questions and a discussion. With respect to the practicalities of this webinar, you will see that everyone is automatically muted. There is a question and answer box that you can use to put your questions in. We would prefer to do that way. Along the webinar, moderators can also already, and co-chairs answer questions where possible, and we will go to that at the end of the meeting, and we will have a moderated session to deal with the questions that are then still remaining. Okay. So here again, you see an iteration of the aims that we have with this working group. We were asked to initiate this initiative by the European Commission, and the main goal is to create detailed practical guidelines on data sharing with respect to the COVID-19 context, to help different groups of stakeholders to be able to use best practices to have a maximum impact and also efficiency of their research and the data that they gather. So the idea is to develop those guidelines for researchers, of course, but not only for researchers, also for policymakers and stakeholder groups like maybe also funders and publishers, to make sure that we maximize data sharing and the responses to the emergency. What are the planned outputs that we hope to produce within the context of this working group? Like I said, the focus is on best practice guidelines. Those guidelines should become available per subgroup of the working group, but also on the overarching level. Recommendations focus, like I said, both at the researchers themselves, and we also hope to get to, let's say, more generic guidelines, higher level guidelines for policymakers and others, all to create a maximization of data sharing. What we have also been working on is a catalog of key resources. This is also done within the different subgroups. And resources are interpreted in a very broad sense. So this can range from key data sets via standards and tools to even repositories and registries and software, etc., etc. The idea behind all of that is, of course, that those key resources will in turn also inform and be a basis for the recommendations that we hope to produce. And then finally, but that will be in a next stage, we hope to also set up a tool with a decision tree to make it more easy for people to navigate the different resources. And we hope to be able to split that also on the basis of the different stakeholder groups. But that is work that hasn't started yet. That is really meant for a later phase. So here again, you see the 5 subgroups that we have currently working under the umbrella working group. And the topics that the different subgroups deal with are omics data, clinical data, epidemiology, the social sciences, and finally, community participation. So I think that were the slides that give you a quick overview of the context of this work. And now I would like to start with giving the floor to the different moderators of the subgroups to give a status update of the work that has been done so far in their different groups. And the first group in line is the omics subgroup. And for that, I would like to hand over to either Rob or Natalie.
Yes, this is Rob speaking. Hello. Good morning, good afternoon, good evening, everyone. So this is a group done together by me and Natalie led. Of course, there are very many other participants, and we have gotten started last week. On the next slide, we have the names of the people that are registered for this group. We have more than 72 members at the moment, and 26 of those people were in our first call, and that first call was actually a working meeting where we started working together on the document. We know there are a few people that have difficulties with the timing of our calls, and so we will be working on making possible for everyone in the world to participate, but we have to figure out how to do that efficiently. On the next slide, there is the scope of our group is explained more. So there are extremely many omics topics. There is a Wikipedia page with a large list of omics topics in biology. What we have said is, as a starting point, that we think omics is the molecular biology that is part of this work. And with the group last week Thursday, we worked on prioritizing the topics that are at the moment the most important for work on COVID-19. And we came out of the obvious virus genetics. We've all seen the trees of the genetics of the virus being collected everywhere. But there are also a lot of people already doing work on the genetics of human beings that are actually being infected. There is, of course, stories on immune disease of the disease already. And there is also the study availability of structural data. Those are the 4 topics that we have decided to prioritize in writing our guidelines. We call everyone who has knowledge in these subjects to contribute to these guidelines. We've made the sections for these prioritized topics in our document, and we ask everyone to contribute. If you have any omics resources that you know of, tools or databases that people are using in these fields, then you can contribute to our Zotero, or use our guidelines documents to point people to it, and other volunteers from the group will add them to Zotero for you. Of course, if you have any free time that you want to contribute, you can also take resources that others have put in there and put them in Zotero for us. So please join the effort if you have any knowledge in this subject. Our next meeting is on the coming Thursday again, and the details are given on our webpage. Thank you.
Thank you very much for that overview, Rob. And then we move on to the clinical subgroup. And whom can I give the floor to?
It's Dawei.
Thank you, Dawei. Go ahead.
Yeah, so this is Dawei Lin. I will present first on behalf of our group, and other people may add information later. And next slide is our members. And then let me go to the next slide. And so we have also our first meeting last week. And this is our refined goal. Is to generate the guidelines for sharing clinical data and to compile a list of clinical resources related to the COVID-19. And then the third one is to develop a decision tree to help stakeholders to navigate the resources and recommendations. Next slide. And go back one. This is a summary of our scope discussions, and there is in 2 areas. The out of scope areas, like software computational resources, are not because they are not important, is just not the focus right now for the group. And so for the in scope area, we're thinking the obvious is the clinical trials, and how to select the trustworthy data sets and repositories, and then things related to the standards, documentations, and data management requirements. And also, I think they're probably share with other subgroups are the legal and ethical requirements. And then some other areas I think nominated are biomarkers and serology and other testing areas. So that's current I think the broad scopes that we're considering. And next slide. So although I think the time is short, but we do want to know where the value is from the work of our working group. So we did the little SWOT analysis and see where the things are. And so the strength of our group, I think, is the broad perspectives and expertise, and peoples are committed and enthusiastic. And the weaknesses are that it is challenging to work together, different time zones, geolocations, and we all use different type of tools. And as Ingrid mentioned earlier, the work is volunteered, so sometimes we have to be kind of consider the priorities that may not be higher than our daily work. But it doesn't mean the quality is low, just the priority wise is need to be considered. But we do think there's opportunities that we can create the cross-cutting recommendations, and then we do hope that they can be the basis for the long-term development. And we all like RDA because we meet people that we will not meet and work with otherwise. And the threats are the work may not be sustainable, and this happens before, like H1N1 and Zika pandemic. After the pandemic's over, and the recommendation may not be followed up, and also because the time is short, we may not reach the consensus to make things forward. But from this analysis, we think maybe the current the value we can easily get is the perspectives from the group. And so this is the small Google Doc we developed, and this is the way that we collect the information for our subgroup. So there were 3 value added columns, which have the block on the topic, is a resource type, descriptions, and comments. And one example I want to give is the second row, for example, in the comment area, and is point out like this particular resource will be operational in 2021. And so that type of information may not be easily to get to the website. So I think this is the things that we can collect. And then we decided to use this form instead of the Zotero, because I think there are a lot of learning need to be done. And then we have a person to put this information into the Zotero. Next slide. And so this is a decision tree. Is not necessarily the final product, but is a way to visualize what the final product may be look like. So this is the things like we're thinking about, like the stakeholders will get the resources and they know what type of the resources they are looking for, and then if like they choose to go to the repository, and then they may choose like the repository for clinical trials, and in the clinical trials you have different the categories of information about clinical trials. And if you select the registry, and then you will see like what is the trustworthy level they have, what type of focus area they have, and then you can select the resources that you're using. And I want to mention, like on the left, that column, which is resource type, and that actually is the sources that we can use to make the decision tree. So when the people enter the information, they're already thinking about what things that can help to make the decision tree. Next slide. And this is the broad the recommendation that we have been collecting. We have collected so far, and you can see it's very broad, and then on the right side, the green annotation is not one-to-one mapping, but I just want to point out that the elements that related to the RDA guideline. And then I should point out that there is already a lot of recommendations being generated. Like for example, the number 7, there is published papers that generate a lot of principles and recommendations. And Ingrid, I don't know if you can click the very bottom, like there was a link, like a strawman clinical data sharing guidelines.
Yeah, I can.
So so this is what the Andrea in our group, the one of the co-moderator worked so hard last night to generate a strawman framework, like say, to convert the raw recommendations into something the structure like this, and hopefully this may be helpful to for people to generate the final guidelines. So this is the work so far we have done.
Thank you very much for that overview, Dawe. Now let me see how I can get back to my original. Ooh, that doesn't work. Let's see how this works. Yes, Now I need to get into presentation mode. This might take some time. Sorry. Now the slides need to load again. And I need to figure out where we were. A bit up, I think. We've had this one. I think we're here. I go to presenter mode and I invite someone from the epidemiology group to take over.
Good morning, everybody. My name is Claire Austin, co-moderator. Hi, co-moderator for the epidemiology subgroup. If you could go to the next slide, please. Next slide. So we have a work plan that we continually adjust. So we've been collecting and organizing resources and references since the beginning of last week. And writing sprints, we gave ourselves a deadline for writing sprint Friday last week. And really there was a flurry of activity through the weekend. So we now have, I would say we now have a core group of very committed people from across the spectrum of expertise who are really digging in and contributing to the writing. We meet 3 times a week, Monday, Wednesday, Friday, and we keep meeting minutes. Next slide, please. So we use Google Drive very heavily. If there are new people or people wanting to join, I encourage, if there are people on the line who are interested in joining the epidemiology group, although the work has started, there's plenty of work left to do, and you should be able to step in fairly easily by going to the README First document. From there, you'll be able to find yourself. You'll be able to find your way around the Google Drive and catch up on what it is that we've been doing. We did send out, I did send out a large number of invitations to epidemiology and public health communities via the associations and boards of directors last week. And the initial work that we did at the beginning, middle of last week, you have hyperlinks at the bottom of the page there. I'll move on to the more recent work. Next slide, please. We have 68 people from around the world who joined the epidemiology subwork group. There are, of those, 30 people completed the membership survey. We've had 4 meetings and about, I would say, a dozen active, what I'm calling active members. So meeting attendance has been, you can see the first meeting, 20 people, then 17, then 9, and then the most recent meeting was yesterday, 13 people. So in our writing sprints, we have, it's not in polished writing form yet, but contributions amounting to 12 pages to identify and discuss the key parameters and elements. And there is a subgroup of our subgroup working on the acronym. I think it was Anne who came up with the acronym of SHEET, meaning Standard Harmonized Electronic Epidemic Data Collection Template. The next steps for this group will be to, from the key parameters and elements document, the 12-page document, to begin writing recommendations and guidelines, and starting today, working on a 1 to 2 page summary of the 12-page key parameters and elements. Next slide, please. So the Zotero web group library started with the epidemiology subwork group, now has been expanded to include all of the sub work groups. When I checked this morning, there are 49 people from across all subwork groups who have now joined the group library. Last week we had 3 tutorials, one beginner, one intermediate, and yesterday one advanced. I wouldn't call it so much, the advanced one wasn't so much as a tutorial as for people who are already expert, and we were discussing and planning how to better organize and curate the group library. When I checked this morning, there were 134 resources or references that had been added to the group library by those 49 people who are members of the library. The instructions for using the library and for joining the library are at this hyperlink on the screen here. On Sunday and yesterday, we spent some time cleaning up the library because there are a lot of people doing it in different ways. So curation, tagging, which is very, very important, and creating collections for each of the subgroups. So the next step, we're forming a very small group of, for lack of a better word, administrators or management to keep things orderly and tidy and in a standard form within the library. We need to come up. I've done some of this work already, cleaning up the tags, but we need to come up with a standard set of tags that works for all of the subgroups. So I'll be working with the co-moderators of the other subgroups to put in tags that people can use that work for each of the subgroups. And then I'm hoping that it will be in shape to be useful for the public, and that we can coincide. Right now it's a private work group, so you need to be invited, and the way to get invited is to go to the instructions there and you'll see how to get invited to join the work group, the Zotero group library. And I'm hoping to be able to switch it to public to coincide with the first release of the RDA COVID-19 work group recommendations and guidelines. That's it for me. Thank you very much.
Thank you very much, Claire. That was an impressive overview. Then we move on to the next group, which is the group that concentrates on the social sciences. And I'd like to give the floor to either Irina or Amy.
Thanks, Ingrid. Hello, this is Irina. And I co-moderate this subgroup together with Amy, and Ingrid is a chair. And if you could go to the next slide, please, Ingrid. I'd like to thank all the people who signed up for this group and for all your involvement and enthusiasm. Thanks a lot. Next one, please. The way we work, we have weekly subgroup calls, so already had 2. We have about 20 people joining in, but we're all working from across the globe, so timing is a bit hard for all of us to meet face to face. And we have our next meeting coming up this Thursday. We had 4 writing sprints, and the way we organized our work to write recommendations and also practical guidelines, we picked up 6 topics plus a scope. We had writing teams and we are now freezing the versions that we have. So we are done with recommendations and with best practice guidelines on each of the topic. And as of today, we also have an editorial team that will merge these 7 documents into one overarching document. And we'll discuss it on Thursday, and we'll share with all of you what we've come up with. And I'd like to mention that we have quite extensive best practice guidance on legal and ethical requirements on informed consent, and maybe that's something that would be useful for clinical working group as well. And if you could go to the next slide, please, Ingrid. So we also refined some of the areas that are within scope of our group. So as of this week, we've added social geography. We've also added some more topics related to urban and rural planning. So that's a list of our current scope, and you'll hear more news from us this Thursday, and yeah, we'll appreciate your feedback on our draft. Thanks.
Thank you very much, Irina. Then we get to the last group in the list, the group that looks at the community participation work and data. And I'd like to give the floor to one of the moderators. And I don't know who exactly is going to speak.
I'll be. I can take this on. Hi, my name is Istima Baro. I am one of the co-chairs, co-moderators of the community participation subgroup. Sarah, who is our subgroup co-chair, Joanne, and also Susanna, I think, are on the call. Next slide, please. So we've seen a lot of interest in this subgroup, and we are very appreciative of that. I think that everyone else before has also mentioned how you can register. So please, join our subgroup. It's a way of keeping in touch via the group mailing list. So we are a little bit of we're off to a slower start, but we have had a scoping document out and available for comment. We have collected feedback, obviously, on the scope of this subgroup, areas and topics that we should be addressing, and some key priorities. The focus of the subgroup, as it has been narrowed down, is on community-generated data. There is a lot of interest in this aspect of the issue and of the context. In the upcoming period, we will be focusing on a 1 or 2 pager on key topics and initial recommendations, and especially on issues related to the app development in this space, and what are the ethics and data management issues related to that. And we're going to follow, as the others have done, the template for the recommendations. So we're going to address issues of data collection, management, and how this data should be shared appropriately. Also, we will be looking into particular standards and repository services as a very key point on as part of these initial recommendations. And we have Susanna, who on the side of fair sharing will be providing particular contributions to this segment. Also, as the others have mentioned it, a key small focus would be on the minimum data sets, and in this case it will be on defining the minimal information and diagnostic questions that should be asked in relation to the COVID information that has been collected, would be collected, and is community generated data. And recommendations will be provided based on how to record these in a very standardized way. Next slide, please. At the same time, just like the other subgroups, we'll be looking into ways of collecting and documenting resources, and we will be using Zotero just like the other groups. A set of resources have already been added, and I think Joanne has been looking closely into that aspect, and also an initial work on defining some of the tags that are very specific to this subgroup has been pushed forward, and we're talking about tags like citizen science app or community generated data, and also issues such as country and regional coverage, which are particularly important because, as we know, in this case of the community generated data, specific legislation and other aspects apply. So the next steps for the upcoming period would be obviously to stay in touch, and we have a Slack for wider communication. Please follow those instructions, and we're also going to have a subgroup call to structure the 2-pager and the resource collection and share a timeline to collect the contributions. Yes, this is the update from our side, but obviously stay in touch via the subgroup working area, because there will be news upcoming shortly. Thank you.
Thank you, Tameya. And with that, we have finished our overview of the work that has been done in the 5 subgroups, and I think it very well shows that already a tremendous amount of work and effort has gone into this. I think it's wonderful what all of you have been able to produce in such a short time frame. So here you see an update of the timeline that we have. The approach has been right from the start to release a first version of our recommendations as soon as possible, and then to revise it in continuous sprints. As has become clear also from these overviews, is that a lot of work is being done in parallel, and that we have this condensed timescale, and that we have subgroups working with slightly different methodologies and with slightly different priorities, which I think is perfectly fine. And now we get to the moment of truth, in a sense that we need to bring all of this together in a coherent way. So the first weeks were spent mainly on collection of those resources and text to produce guidelines and recommendations from. And this week we will try to focus on the first release, which means that the different groups will try to create a document, a small document with key guidelines and recommendations, a kind of status update. And we hope to release that on the Friday, and those subgroup guidelines will be accompanied by an overarching document as well. That first release on Friday will not be the last one. Like I said, from there we will be continuously expanding and revising our outputs. So again, to reiterate, next Friday we will be working towards this high-level summary of efforts with both the subgroup summary of recommendations and an overview document. When we have that completed, it will be published on the RDA website, so you can see it appear there. And this will be done with a request for comment functions, so it will be openly available to everyone, and this also provides the option for the whole of the RDA community to comment on those first products. And of course, more detailed versions of all of the documents will come at a later date. And there is also the possibility that some of these first outputs will have links in them that lead to further documentation that was already gathered but not yet incorporated in let's say, the key document. And I think that was the last slide in this series. Yes, which is good, because we wanted to have some time reserved for the questions that we have in the question box. And with that, I hand over to Mark and Mary to moderate this session on questions and answers.
Yeah, thanks, Ingrid. We don't have too many questions today. There was one or two linked questions relating to biosample or biospecimen data, whether from patients that have been in hospital and discharged, or those that have died. And that would include, the question included question about whether or not images and biospecimen type data would be in scope and dealt with. I can say that we are looking at a way to, we have a number of cross-cutting themes, which I think you've heard that term used a few times, including ethical and legal and software, as cross-cutting across all 5 groups. We are also looking at a response in the context of image data and how we can best facilitate a best practices response to that in the text of the guidelines. And I would invite Dawe or anybody else on the clinical team to respond, but I'm assuming that there would at least be some mention of biobanks or biospecimen data in the guidelines.
Yeah, this is Dawe. I think definitely, I think that autopsy data, I think that seems very well within the scope of clinical group. And in terms of clinical imaging, I think there's some cross-talking between the omics group and the clinical group. And I think I heard like the decision is that maybe the clinical group will take care of the clinical imaging information.
Okay, excuse me, thanks, Dawe. We also have a question regarding the overarching recommendations and the process and how that will work. So maybe I'll just give a brief description of what we're looking at this point, and then any of the other colleagues on the call can respond as well. So as Ingrid highlighted, we are looking at kind of an initial high-level summary by the end of this week. One of those documents will have a kind of a high-level summary of the overarching recommendations and extract whatever we can in this short timeline. And then, of course, the 5 high-level documents produced by the groups will be included and linked into that as well. So the goal is to continue that work by having whether we have a smaller editorial team that looks at all 5 subgroup documents and kind of brings them together in a summary or overarching document. So we are actively looking at how to best approach that step of producing the overarching document recommendations and pointers to the other ones. I don't know if anybody else would like to, the co-chairs or moderators would like to respond to that one as well.
Well, Mark, maybe only in a way, in a sense that we already know that in this first iteration, we will have a contribution from the Research Software Alliance with respect to more generic recommendations concerning software. And we will probably try to have for the next iteration a cross-cutting group of people with expertise in the area of legal and ethical requirements to draft generic guidelines in that area as well for the overarching document.
Yeah, and just for Catherine, who asked that question, if you're interested in participating in that kind of overarching writing initiative, then please reach out and we can pull you into that conversation. Another question about biomarkers. Not sure what, is there any of our moderators that would, where the subgroups have talked about biomarkers? I'm pretty sure it has been discussed maybe in Rob's group.
Anne speaking.
Okay.
It has been discussed in the clinical group, and I was in one meeting of the omics group where this was also discussed, so the moderators can intervene there. So there are different kinds of biomarkers. Obviously, there are many falling in the remit of the omics group. And for the clinical group, there was a certain focus on the biomarkers used in diagnostic and follow-up of the clinical stage. If any one of the moderators want to add on that.
Yeah, so Rob Hoofd from the omics group, indeed, we had the discussion that part of the biomarkers would be in scope for omics as far as they are molecular biomarkers, but this is obviously a topic that needs to be discussed between the moderators of the different groups, and this will be done in order to make sure that nothing falls between the cracks and no work is being duplicated.
All right, thanks, Rob. And I would note that Natalie has added a link, just another indication of how some jurisdictions are dealing with the tissue biospecimen question. So Natalie Myers has added a link into the approach that's being taken in her state in the US. I don't see any other questions. Ingrid, I would point out to people, and if somebody has their fingers on a keyboard with the RDA COVID-19 working group landing page at hand, we do have an FAQ, which is developing a good set of responses to the various questions that have been asked and that we didn't have time to answer on previous calls. And I see somebody's just put in the link to the slide, so that also answers one of the questions that was asked about the slides being available, and the recording will be added to that soon after this. And if we get a chance, we'll also add in a link to that FAQ page, which has additional answers to questions. And I guess we have one last question here. Question about the public Zotero collection and how that would function. Claire, did you want to take that one?
We're not at the point yet where we're wanting to make it public. This is a wish. So right now it is a working tool for the subgroup member, all of the subgroup members and co-moderators. I would want to wait and be sure that the library is well curated and well organized beyond even what our immediate needs are, so that it is presentable publicly. I don't want to make it publicly open right now because it's a work in progress. So when people surf to the library, I want them to have a good impression and want to come back, not a bad impression because it's a work in progress and not return. Does that answer the question? I didn't see it in the chat. So right now it is private. Private meaning that it is open only to the RDA COVID-19 work group members, not for the whole world publicly.
Okay, thanks, Claire. I think that answers the question. So I think the additional added on to that question was the individual wasn't advocating that it be public, but rather to understand what it means and how a public Zotero data set functions. I don't know if you wanted to add anything to that, Claire.
Right. So at the point of making it public, so that it remains well curated. Our thoughts at the moment are that it would be public for anybody in the world to view, and we are in the process of assembling a small group of administrators who would continue to curate the library. And at the point that it is public, RDA subgroup members would continue to be able to edit the add resources. So
okay.
That's the current thinking.
All right, thanks, Claire. Any other questions? I know we've got a few minutes left, but Hillary, did you want to say anything on behalf of RDA?
I did, actually. Very quickly, I don't want to keep anyone, I know we're towards the top of the hour. I just wanted to thank everybody so much. It's quite unbelievable. And I always find it hard to find the words, but the power of the community is amazing. And I know that I'm very grateful to the co-chairs and the moderators for all the work that they're doing, but I know that today they tried to also honour the members in the slides. It's very hard just to stick somebody's name up there. We will try our very best to ensure that you all get the recognition for this amazing work that you have done. With the Secretariat, we're working out a communication plan that will start to support the activity as best as we can from Friday, when we have the first release, and then going forward. But I just wanted to thank you so much, really. We were called to action very quickly, and I'm very grateful that you all have done, I don't know, given all your expertise and your passion and your dedication to do this, which I'm convinced this is going to make a difference for the world at large. And I'm glad that RDA shows that a concrete contribution. So that's what I wanted to say to you today. Thank you very much.
All right, thanks, Hilary. Ingrid, shall I pass it back to you for closing remarks?
Sure, thank you very much. Well, I would only want to say that I first of all would thank very much the moderators for their contributions to this webinar. And I'd like to thank everyone for joining us and for showing an interest in our work. It's great to see that again we had over 70 people joining this call. I would like to ask you to keep an eye out on the RDA website for the first outputs that we will hopefully produce on Friday. And I would like to invite you all for the next webinar that will be held again next week on Tuesday at 11 o'clock UTC. So thank you all very much and hope to see and hear you all next week. Bye, everyone.
Bye.